But my name is Jeff Strobel, and I had the distinct honor of teaching history to 7th and 8th graders here from 1994 to 2004. And despite the fact that I went on to be head of the middle school for 3 years and then head of 2 different independent schools, to be honest, the years that I spent in the classroom here at Sycamore were by far the most enjoyable and rewarding years of my career. And there were a lot of reasons for that, but the biggest reason was the just incredible students that I had an opportunity to teach, some who are in the audience here. And it is really an honor for me to be able to introduce one of them to you tonight. Like so many Sycamore students, Dr. Neha Yakhmi was smart, hardworking, eager to learn. However, what I remember most fondly about Neha is something that Mary touched on, and that is Neha was one of the kindest and most considerate students that I ever encountered in 30 years as an educator. And I am thrilled, and I think we're all very fortunate that she has chosen a career in healthcare. Dr. Yakhmi is a 2002 graduate of Sycamore. She went to Park Tudor for high school and Washington University in St. Louis for her undergraduate work, where she majored in Spanish and biology. Neha attended medical school at the University of Toledo, where she couldn't decide who she liked caring for the most, children or adults. And as a result, she decided to pursue a combined residency in both internal medicine and pediatrics at the University of Texas, Houston. It was there that she fell in love with allergy and immunology as a specialty. It's an exciting field that is rapidly changing. After finishing her fellowship at St. Louis University, she returned to Central Indiana, where she is currently on the staff at Riverview Health. So please join me in welcoming Dr. Neha Yakhmi.
Neha is going to do some allergy testing on some volunteers. So would the 3 volunteers come on up now, because she needs to test you at the beginning so that you can sit for about 15 minutes and then she can see the results. So if you would come up here.
Excuse me while I set up for a second here.
You can just go over that way.
All right, you guys want to come up here? Yeah, so I'll tell you all a little more about me in a second, but first of all, thank you, Ms. O'Malley. Thank you, Mr. Strobel, for that introduction. You make me feel very special. So I'm going to do some skin testing on you guys. It's just a sample panel. This is what it looks like. This is what we do in clinic, only more. So these are the devices we use. First of all, no needles. That makes everyone happy. But little plastic devices have these little star shapes on the tips. What we're testing with is standardized purified extracts from whatever we're testing, whether it's food or environmental allergens. Today we're doing environmental stuff. And gets pricked into the skin, very superficial, does not hurt. Leaves that little star-shaped mark on your skin. Takes 15 to 20 minutes, so perfect time for this talk. So whoever wants to go first? Okay. I promise it doesn't hurt. You will get itchy, but I've got some hydrocortisone cream for that, so don't worry. And I'm going to fall over. Okay. All right, which arm would you like?
Let's go left.
Okay. So just cleaning off with an alcohol swab.
Okay.
And then just a gentle prick on the skin. Doesn't hurt, unless you tell me it did.
No.
Gonna mark you, the surgical marker, just so I know where I pricked you.
Okay.
And then paper towel you off. That is it.
That's it?
That is it. All right.
All right. we go.
So we do this times 6 for our standard allergy panels in clinic. But we're just doing a sample panel today, so this has got a little bit of everything. The top 2 spots are our controls. So one is our positive control, or histamine, so that's going to get itchy. One is our negative control, or saline, essentially saline. That should not react at all. And then we've got cat. I'm switching up from this afternoon. A mold, a tree, a weed, grass. All right, you ready? All right. Itchy yet? All right, we'll regroup at the end. All right, so I'll clean this up later, but I want to talk about a few things today. So my key points really are, number 1, the easiest path is not always the best path. It's kind of a theme of my life, but also a theme of Sycamore. Next, know what you don't know, which is a lot, what we don't know. Decisions are hard, and we are all lifelong learners, whether we want to be or not. I have a lot of pictures thrown in here, courtesy of my classmates, because apparently they were much better at taking pictures than I was. But up there is band camp, back when we went to Marion, I guess it was Marion College then. We got our class quilt. We have our mystery dinner theater. I don't know if anyone ever did that after we did. And then our rocket project. No idea why everyone's looking at me. No idea why I'm sitting and I have no rocket. So, anyway, as everyone said, I'm Neha Yakhmi, graduate from 2002. I went to Sycamore for 10 years, starting in what was called P5 back then. I was the only one in my preschool class to make it to middle school, let alone graduation. There were a few kids in the other preschool class who were in our class, but I guess they were a separate group. So, the easiest path isn't always the best path. Everyone's seen similar figures to this. Point A to point B, totally easy to go a straight line, but life isn't like that. And everyone here probably didn't choose that easy path. Everyone here sent their kids or worked at Sycamore or has a connection to Sycamore, where we know at Sycamore you don't take that straight path. You're challenged every day, not just academically, but your beliefs, your viewpoints on the world, everything is challenged. So our paths are never a straight line, and mine definitely wasn't. Not just geographically, but decision-wise. So after Sycamore, went to Park Tudor, went to Wash U, went to Toledo for medicine, Texas for residency, St. Louis for fellowship. It's a very long road, lots of training, lots of school. Didn't get my first real job until the ripe old age of 32. So I'm a good 10 years older than the rest of you who are talking today, at least. But also, the principle of the easiest path isn't always the best path really applies to what I do at work every day. The 2 things I was going to talk about really are related to allergies. So a lot of things that are labeled as allergies really aren't allergies in the strictest sense of the term. And that matters a lot in my field, semantics. Adverse food reactions, commonly called food allergies, but it's really not just food allergies. It's a big spectrum, ranging from what I would call a true food allergy, where our immune system is involved, and specifically there are allergic antibodies involved, to sensitivities and intolerances. And intolerances can include things like lactose intolerance, for example, or other side effects related to some foods. For example, heart palpitations when you have too much caffeine, or scombroid fish poisoning, which seems a lot like an allergic reaction, but is actually just a reaction to having spoiled fish. And then sensitivities can be a whole spectrum of symptoms, whether it's acid reflux or migraines, and everyone is very quick to blame food for these things, and food can be a trigger, but it's not always food allergy. So the easy thing for me to do in clinic would be someone comes in saying, I just want to know what I'm allergic to, and to do a whole panel test of 50, 60 foods, see a bunch pop up positive, say, you're allergic, avoid these things. But is that the right thing to do? Absolutely not. For example, food allergy testing really is only helpful if you have symptoms suggestive of a true food reaction. We're talking hives, swelling, struggling to breathe. Those are the types of reactions where allergic antibodies involved. If you're testing for things where a person doesn't have that type of reaction, you're not really getting useful information. And in fact, you are actually potentially causing harm to the patient. And again, if you're testing for an allergy, food allergy testing for things a patient isn't allergic to, they eat on a regular basis, for example, tomato, and it pops up positive, are you going to tell that patient they're allergic to tomato? No, because they eat it all the time and they have no issues. In fact, all you're telling them is that they're sensitized to the food, not sensitive. And if people avoid foods they're sensitized to, you actually can develop a life-threatening food allergy. So then you've really caused the patient harm in the future. And so I spend a lot of time with patients telling them why I don't recommend testing for them and why I don't do big food panels. Because sure, I could make a whole lot of money if I tested everybody for 50 foods, but definitely not the right thing to do. And then the other thing I feel strongly about is penicillin allergy and drug allergies in particular, but penicillin's an interesting one because, as you probably all know, a lot of people believe they have a penicillin allergy from what they've been told or what they've experienced. It's actually 10% of people. But probably 90% of those people are not truly allergic. And when they see an allergist, when we talk about it, when we do testing, turns out they can take penicillins. And the easy thing for me to do would be to just ignore it, just leave it on their list and say, ignore the avoid penicillins. There's plenty of other antibiotics out there. But those other antibiotics are usually not the best choice. For example, broad spectrum antibiotics, those are antibiotics that target a whole lot of different organisms, not just specific ones. They're often used as an alternative, but they cost more, they can have more side effects, they can lead to antibiotic resistance, and they might not actually treat your infection very well. So it's important to evaluate penicillin allergy. For example, if a patient had a reaction as a child, there's a very good chance they've lost that sensitization over time. In a 10-year period, 8 out of 10 people lose that sensitization. Then there's people who had side effects from penicillins, but they're not truly allergic, and they probably can take them without issues now. And then there's plenty of people who have a family history of penicillin allergy, and so their parents told them to put it on their chart and never take it. Well, penicillin allergy isn't inherited, so I do a lot of talking to patients about that too. So, more pictures from Sycamore days. There's our volleyball team. I think we were in 8th grade then. There's band camp. So next, know what you don't know. This is a common phrase in a lot of fields, especially applies to medicine. You have that big orange pie piece, what you don't know. Blue piece, what you don't know. And then green, smallest one, is what you actually know. Our job is to shrink that orange piece, even though we're probably mostly adding to that blue piece, but that's half the battle. And then slowly, we make our green pie wedge bigger. Sycamore helps us do that by introducing us to new fields, new ideas, new places. And so sure, our green piece is growing slowly, but our orange piece is getting a lot smaller. we're open to the world, we know a lot. For example, our field trips. And again, these are really grainy old pictures, so I apologize. But we've got, I think these are Smoky Mountains pictures. And so, why did I pick allergy immunology? Because this is a field where things are changing so quickly, our knowledge is changing so quickly. Yeah, that means the orange pie piece is growing a lot, but I'm chipping away at it, adding to my green and blue pie pieces, and I'm never bored. See all sorts of stuff. Decisions are hard. Eva, was this your picture? I can't remember. So, this isn't unexpected when we're fortunate to have so many choices to make. Sycamore opens up all those opportunities to us. It really opened up a lot of opportunities to me, just opening our eyes to all the possibilities we have before us. But basically at every turn in life, I had a really tough time making those decisions. I made my college decision on the last possible day. I wasn't even sure I was going to go into medicine when I was applying to medical schools. I was also applying to interpreter jobs and teaching jobs, and well, it turns out it's really hard to interview for med school positions when you're not sure that's really what you want to do. I didn't know what I wanted to do for residency, like Mr. Strobel said. I like adults and kids, so I made it a little harder on myself and did both residencies, or combined residency. Decided to go into fellowship at the last minute, but I was able to pick one where I still got to see adults and kids and do what I love. And I wasn't sure what kind of job I wanted when I was applying for jobs either, so I applied for all sorts of positions all over the country. But every step of the way, I had the skills to help me make those tough decisions. And even though I agonized over them, I never felt that I chose wrong. Probably could have chosen better sometimes, but then I wouldn't be where I am today. And the other point of this is, in medicine, decisions are hard too. There isn't one right choice, and the right choice differs from patient to patient. There's definitely wrong choices though. And I've learned the skills to help me make the right ones, and that started here at Sycamore. Knowing what you don't know is half that battle. So my final point is, we are lifelong learners. We've doomed ourselves to that fate. Sycamore instilled that thirst for knowledge in me and all our classmates. And keeping it up through life, we've all gotten far, I think. Lifelong learning, definitely important for a career in medicine, because knowledge is constantly changing, especially in my field, where everything's changing so quickly. My final words were really advice for middle schoolers, so I'll skip those. But here's our 8th grade class, our final band concert, and our DC trip. And we are probably just in time to check up on our skin testing patients. I shouldn't say patients, volunteers. Do you guys? Okay, let's see. All right. Okay, so you are not allergic. I don't know if anyone can really see this. That's her positive test spot, the histamine, reacted like it's supposed to. Saline spot is here, so it's just a little red spot from being poked. You have maybe the slightest reaction there to dust mite, but it's nowhere near your histamine, so it's not something I would really worry about. Would you like some hydrocortisone for your itching?
Sure.
I'm just going to squirt it on and let you rub it in. That was way too much, so I apologize.
Thank you.
All right. You're not allergic either. Congrats. That was less hydrocortisone. You can rub that in if you want.
Okay.
But yeah, just to help stop the itching. It does go away eventually, but. All right. You said you have a lot? Okay.
Okay. I'm getting like a free doctor appointment here. So, as a child, I'm not allergic to anything. Nothing.
Okay. You reacted to almost everything. So, histamine spot positive, like it's supposed to be. Saline was negative. But then you reacted to alternaria, which is a mold. You reacted to cat. Dust mite, not so much. You reacted to the Timothy grass, the ragweed, and oak. I'm sorry. So, like I said, this is a screen. You can spread that over so you'll be less itchy. But yeah, we do a whole panel in clinic with a bunch of each category of thing. But
then I'll get your email.
Sure. All right, and then since you guys can't really see up here that well, this is kind of what the testing looks like. So this example is the device with just that histamine, so that's why everything looks about the same size. But negative spot doesn't react, positive spots get what's called a wheel, that raised thing that kind of looks like a hive. So that's how we do our testing.
This is all fascinating, but I had a question for you about some of what you were talking about with penicillin and people thinking it's heritable and those kinds of things. And it kind of relates to your talk. How do you get people out of their storytelling and into your data?
I mean, it really depends on the person. Some people come to me with, no knowledge, or they haven't read anything, and so they're really surprised. They're pleasantly surprised, and we do our testing, which for most people actually just involves a drug challenge in clinic, so kind of long and boring. But then there are other people who are very, very hard to convince, and there's some people you can never convince, and I don't give up on them, but I've accepted that I can't convince everybody.
Yeah, you're right. There are storytellers that need to start thinking like scientists. Sorry, I just wanted to steal the mic really quickly because you tested kids this morning, and all three of them had more reactions. Well, apart from our super allergy, are there any misconceptions about age and allergies? Does it make sense that the adults had fewer allergic reactions than the kids?
So without knowing their backstories, sometimes. So I see a lot of adults who will come to me and say, I never had allergies until until I hit my 40s. Never had allergies as a kid. Now I just have year-round chronic drainage and stuffy nose. And probably, not, I don't know, 2/3 of the time I test those people and they're negative. And it's because their story doesn't fit. And exactly, it's storytelling, history, where if it appeared in adulthood, if there's not seasonality, if they're not having some of the classic, like itchy eyes or itchy nose, things you kind of typically associate with allergies, and it's just kind of this constant onslaught of sinus stuff, most of the time they're not allergic. And I warn people about that before I test them, because otherwise people get really upset or they don't believe you.
Is it true, I've been doing allergy injections for about 30 years now, that you don't grow out of that?
Grow out of allergies, or?
That I will continue to have my allergy injections run, that I will get to a point where I have enough of it in my system that I don't need this anymore.
You should be paying her money for this.
So I will say the old school answer would be, actually a lot of allergists would keep their patients on injections forever. I don't want to say anything bad about your allergist. I don't know who they are. But depending on who you're seeing and the dosing they gave you, really an effective course of allergy shots lasts about 5 years. Now, there are exceptions for everyone. Some people really just don't respond as well to allergy shots, and they're on them a lot longer. But typical person on them for about 5 years. At that point, you've gotten a lot of immune benefits. So you're not only desensitized to what you're allergic to, so you don't have symptoms, but you've also caused long-lasting immune changes. So even when you stop shots, you shouldn't have a return of symptoms or not a big return of symptoms. And after about 5 years, most people don't get a whole lot of continued benefit. So that being said, I have patients who have been on them for most of their life, and they never want to stop, and that's okay. But I tell them they might not be getting a lot of benefit anymore.
Stress, trigger, allergies. I never had any allergies till I was 18, and I was a freshman in college, and was working summer in a department store with a very strict boss. And that summer, my eyes swelled up, I started wheezing, and from then on, I had hay fever until I was pregnant, and the doctor said, we don't give you an injection, and that seems to be a lot easier now.
Okay.
I mean, it seems like situations affect you.
Yeah, that's interesting that you said that. So I haven't really seen stress as a huge factor for seasonal allergies in most people. So it's interesting timing for you. But the one place where I do see stress as a factor, even if there's not really scientific data behind this, is with people who have chronic hives or chronic swelling episodes, where stress absolutely ends up being a trigger, amongst other things.